to order. Um, hello, good to see y'all all. My wellness tip for the week is if you use natural sunscreen to adhere to the 2-hour reapplication suggestion. So that's my tip for you. Before we get started with any official agenda items, however, I would love if everybody could introduce themselves, starting with the folks in the room. I'm going to popcorn it to Stephen because you're the first person I see.
Thanks, Liam. Stephen Wilson, prior member of the leadership team and resident in Mecklenburg County. Well, I guess you.
Okay, I guess he's passing it off to me. This is Catherine Maloney with Tri-County Community Action Agency. I'm a Charlotte County resident, but I do a lot in Mecklenburg and Halifax. I'm a past leadership team member and been with the coalition for a few years.
Many years.
And I'll popcorn it back here to PDH.
Destiny Terry with Virginia Department of Health and Danville.
I'm Sandie Currie with BDH, and we cover Pennsylvania, Danville, Halifax, Mecklenburg, and Brunswick, our population health.
Hello, I'm Consuelo Price with BDH as well, and we cover exactly what Sandie said. Hi, I'm Barbara Johnson. I'm a community health worker with the Virginia Department of Health, and we serve Mecklenburg, Halifax, and Brunswick County.
Popcorn in the back.
Hi, I'm Destiny Watson with the Virginia Department of Health. I serve the Mecklenburg.
All right. Oh, and I'm Kenan Tyner-Smith, fiscal agent for the Southside Wellness Coalition. And that's everyone. Oh, Dennis
Where's
stepped
Dennis?
out.
Okay,
Dennis, so we'll catch him when he comes back.
cool.
So popcorn it to your team. How about Brenna?
Good morning, Brenna Lake, Population Health Manager, Pennsylvania, Danville, and Southside.
I'll go next. I'm Sherry Elena Martin. I am on the leadership for the coalition. I'm also the housing case manager at Tri-County, and I'm joining you from Charlotte County today, even though I live in Halifax. And I will popcorn it to Allison.
Good morning, everybody. I'm Allison Byrne, and I am the Community Engagement and Partnerships Coordinator at the VA Hospital in Richmond, and I will popcorn it to Elizabeth.
Elizabeth Kopp, Community Engagement Manager, Girl Scouts Virginia Skyline, and the one county I serve that your coalition serves is Halifax County. Thank you.
All right, I can go next. Hey y'all, my name is Liam Hudson. I have the privilege of being the current chair of the Southside Wellness Coalition. I'm also the founder and CEO of the Lean In Project, which provides crisis services in Halifax, Brunswick, Mecklenburg, and Charlotte County. And I will popcorn it to Jeanette.
Great day again, everyone. As you can see, I'm outside. It's only 90 degrees. But anyway, I am the community health worker in Brunswick County for Brunswick Health Ambassadors. And we are in collaboration with the wonderful Virginia Department of Health. And of course, my supervisor is Miss Brenna Link. And we have a great team with population health. And I'm glad to be here, and also with Southside Leadership. Thank you, everyone.
Hey, thank you, Jeanette. That was awesome.
And I don't know who to pass it to. I can't see everybody on my screen.
I think Ashley is next.
Come on, Ashley.
Hello. It's going to be hard to top that one off. But hi, everyone. My name is Ashley Venegas. I'm from UVA Cancer Center. I'm located in Danville, Virginia, and I see some familiar faces. Thank you guys for having me here today.
Yeah, thanks for being here.
And Leah, we have more people in the room.
Woo-hoo. All right, passing it off to you.
I know. All right, so popcorn behind Barbara. Ma'am, Dennis isn't back yet, but
Kenan, I'm having a hard time hearing the folks in the room now. It was clear a minute ago, but now it's pretty muffled.
oh, okay, well.
Oh,
it's a
you're
hard-
back.
Some folks don't have as big mouth as I have. A hard time too. Okay, well, let me push the owl up. Hang on one second.
Thank you.
No worries. Is it? Okay, thanks. All right, we'll talk a little bit louder. Y'all gotta talk a little bit louder. All right, we're ready.
Okay, all right. Thank you, everybody, and welcome again. Thank you for introducing yourselves and for spending some time with us this morning. Before we get into this week's agenda, I'm going to pull up our last month's agenda so that everybody has a chance to review the minutes and we can call for approval. Give me 1 second to do that. Oh, that's my inbox.
All right, we've all got the minutes in the room.
Okay, the minutes are in the room.
Huh?
Can you all see the right screen now?
Yes.
Okay. All right, so I'm going to pause for just a few minutes and slowly scroll through these for the folks online and the folks in the room if you'll just read along. If you have any questions or comments or additions you think need to be added, please bring those up when we call for approval.
Are you guys okay with keeping it on speaker view versus gallery? That way I think it makes it clear who's talking.
That's fine.
Yeah, I've done that before sometimes I don't. Sometimes I think it makes better sense.
All right, so a pretty packed agenda. Any thoughts, questions, comments, or edits before we call for approval? Hearing none, may I please get a motion to approve?
I'll motion to approve the minutes from May, or June, sorry. Ooh.
Okay, we need a second.
Second.
All right, motion is passed. It's Catherine and Stephen.
All right. I saw Elena trying there, but I don't think she got off mute.
I can put her in
Did
there.
it, but now I am.
We can have 3 people approve the minutes. I'm good with that, Robert.
Why not?
Why not?
All right. Good morning, everybody. Thank you for approving the minutes from our last meeting. As always, thank you to Kenan for being such a diligent accountant of all things Southside Wellness Coalition and making sure that everything is tracked and recorded correctly. At this time, I'm going to turn it over to our presenters, Barbara Johnson, Destiny Watson, and Tara Rogers from VDH with Health and Rankings in Mecklenburg County. So thank you all for being here.
All right, and Barbara has a larger team she's going to introduce, and I'm going to go ahead and put on the PowerPoint presentation for her team. All right. Oh, okay.
Resource.
All right, Sandie's coming up.
First of all, just like to say good morning, and I thank you all for inviting us and giving us this opportunity to come and present to you some information concerning resources that are available at, the local health department. So this morning I have with me, I'm Barbara Johnson, Tara Rogers, Destiny Wilder, and Sharon Nicole. As we stated, we are community health workers with, the Virginia Department of Health. Tara, Destiny, and Sharonda, they are placed at PATH. Destiny is at PATH in Morton, Virginia. Sharonda and Tara is at PATH in South Boston. So what they do, they mainly deal one-on-one with residents or patients that come into their offices that need more resources or more help on a personal level. Myself, I'm out in the community doing community events. And they also assist me with that, as you can see this morning. I done poured them all in, whether they were willing or unwilling, I got them here. Right, pour those in. So, and then, we have Consuelo Price, who is our program outreach, coordinator. And then our program administrator, Mrs. Sandie Currie. And they will be doing the presentation on, Mecklenburg County health rankings. Unfortunately, Dr. Wood wasn't able to be with us today, but God always got a ram in the bush, so these are our two rams. So I'm gonna begin by just telling you with Mecklenburg, what we do as community health workers, we try to go out and make people aware of services that are available at your local health department. Because we know that we do live in a rural area, and we know that a lot of people can't afford health insurance, and a lot of people just don't know about the resources. And then too, we have a lot of other resources that are out there. We have urgent care, we have the ER, we have special family medical practices and stuff. So people have a tendency, they have forgotten about the health department, because a long time ago, the health department was the main source. That's where you went to get everything. So we just want to let people know that they still can go there and get services, especially, if they're unable or they don't have insurance. So one of the things that is available at your local health department, and you can now go there, pay $12, and you can get copies of vital records, like birth certificates, marriage license, divorce decrees, death certificate. You can go there, fill out the paperwork, and you can pay $12, and you can get those documents the same day. You can also get copies of your vaccination records. You don't have to pay for that, but you can ask for that. And no matter where you have, if you had them in the state of Virginia, it has been logged into their system, and they can pull it up and give it to you. Also, we have a program called WIC, and that's the Women, Infant, and Children Program. And what that does, that provides vouchers. They said vouchers, but it's little card that looks like the EBT card that they get. And they can take those and go to the local, a lot of the farmer markets are also accepting those. But they can go to the grocery store and they can get nutritious food or to prepare and make a meal. Like they can get eggs, they can get cheese, they can get milk, cereal, bread, fresh produce, canned goods. They can get all of that. So it's still a way for them to have a nutritious meal. And that's mainly focused on moms with children ages 5 and under. It also provides them with breastfeeding education. And they can also get a free breastfeeding pump. And they qualify for EBT and WIC program. They can get safety seats, car seats for their children. And they can also get the pack and play, the pen that they can take with them. We also qualify for that. One of the other services that we provide is vaccinations. Children can go there and they can get the vaccinations that they need for school, like for measles, mumps, rubella, all of those required shots that they have to have for school. They can go to the health department and get those. Now, it's not a charge, but if they ask you for your insurance card, they can't get anything other than what the insurance is willing to pay. We also have vaccinations for adults. We offer the regular flu shot, the COVID shot, booster shots, you can get the pneumonia shots, shingle shots. So we have all of those vaccinations available. But what I do tell people is when you go there, please call before you go. And when you call, they can either give you an appointment or they can, let you know when they're having a walk-up clinic. And since I'm talking about COVID, we know that COVID is on the rise again due to, the weather's warm and people are gathering up more in crowds. So, if you have any COVID tests at home, just know that they're still, even though they have an expiration date on the side, most of them are still good at least 6 to 9 months after that. And you can go on the CDC webpage or the FDA webpage, look up your brand name and the lot number, and it'll tell you if that COVID test has an extended life date on it. So please do not be throwing them away. I always try to throw that out there because a lot of people don't know that, and they was throwing away tests that they could use, and we know that the government's not giving them away anymore. Also, we do tuberculosis screening, HIV screening, and it's a screening that you need if you will travel overseas. You can go to your local health department and get that. Also, if you have someone that you think may qualify for nursing home placement, they also help with that. That would be a nurse from the health department and a case manager from your local social service department. They'll go out and do those screens. One of the other services that we offer is our environmental health services. Now they go out, they inspect campsites, immigrant sites, restaurants, food trucks, campgrounds, anything to make sure that they are following the state regulations that they need to be following as far as they're concerned. Now they will go out and inspect websites, but they do not test well water. But they should be able to refer you to someone that can do that. They also investigate rabid animal sites. And then finally, the other service that we offer is what we are doing here today, just going out into the public, making sure that we get the word out that there are services still available at your local health department. We go to clubs, organizations, food banks, census, anywhere that someone is willing to accept the information. We go and do a little short presentation like this, and we just hope that, we said something to, let people know that services are available. And we try to reach these people because we live in these rural areas. We know what the health disparities are. We've experienced some of them ourselves. So we go out and we try to get that information out there and develop trust, in the community, because people can't come to us. Like I said, they deal one-on-one. I'm out in the community, but if someone called me and I can assist them and refer them to service, I do that also. And one of the other things that we offer is the ARPA funding. And that's a grant that was put in place. It's called the American Rescue Plan, that was put in action by President Biden in March of 2021. Now, it's available to everyone, but for us, we use it as a reimbursement grant. By then, we get people to put it on an event. They pay for everything, the food, the speakers and all, and then they can turn in receipts and invoices, and they can be reimbursed. The agency can be reimbursed for the money that they spent. And I can witness to that because I just did a women's health brunch for breast cancer at my church and my missionary society. They paid for it, they funded the event, and then I turned in the paperwork and all the receipts, and they received their check within 4 to 6 weeks. So now that I'm out of breath, I'm gonna let Tara read this.
Again, my name is Tara Rogers, and I'm not gonna be as entertaining as Ms. Barber here. But I'm a community health worker for PATH. PATH is a rural medical center. We have them placed a little bit over a couple counties. We have Boynton, South Boston, Danville, Chatham. And part of my job there is to make sure that patients are able to make it to their doctor's appointments. A lot of the issues that we face at home prevent us from being able to treat our medical issues. If you don't have food, if you don't have water, if you don't have transportation, those issues stop you from being able to go to your doctor's appointments. So I'm in the middle there trying to make sure that these issues are taken care of. I've transported patients to their doctor's appointments or, making sure that they have food at home. I deliver food boxes to, residents in the area. I make sure that they have personal hygiene products at home with them. But, some of the services that PATS offers would be medical. So a lot of people, they go to your urgent care or your emergency room instead of having a primary care physician. So all of the PATS offices they do have new providers come in all the time to take new patients so they can have primary care physicians, and they try to work with your schedule as much as possible. So they take care of that, and then a lot of patients come in with, diabetes, hypertension, high cholesterol, things like that. So they help you treat those, and they work with you to try to create a new meal plan and, lifestyle changes so they can combat those issues. We have behavioral health, in the building as well, especially in South Boston. And they're part-time at the office in Boynton. So people that are having mental health issues can come see a psychiatrist or a therapist there to get medication prescribed or just, talk about what they're going through there. We have OBGYN services in office in South Boston. Granted, the hospital in South Boston does not deliver babies anymore, but they will partner if you choose to go to Lynchburg or South Hill or Danville to deliver your baby. They will partner with your doctor there to make sure that the care is an easy transition. We have something called a sliding scale for some of our rural patients that have low income. So you bring in your pay statements or your W-2s, and then they put you on a sliding scale so that going to the doctor, having these services done is something that you can afford. Whether you have insurance or no insurance, or you're underinsured at all, you can still be seen at PATS. And I will let Destiny cover some of the other programs that PATS offers.
Well, as Tara said, I'm Destiny Watson. I am housed at the PATS Medical Office in Boynton. Just like she mentioned, I work as a community health worker there, where we assist patients with any needs that they're struggling with at home to be able to come to their doctor's appointments. Like she said, we assist them if they have issues with paying, light bills, or the lights are about to be put off at home, they don't have water, they are in need of food, or things of that nature. We assist them with that. As she stated, we have our medical services here in Boynton. We do medical, we have dental, behavioral health, and we do neurology as well. So, like she said, we offer our sliding scale for patients who don't have insurance, to where they can get on these sliding scales to be able to be seen whether they don't have insurance or not. We also have a pharmacy in Boynton and South Boston as well, and our pharmacy also offers a medication program, to where if they don't have insurance or they don't have the means to be able to cover their medication, we're able to assist them with that as well. But that about sums up all of our services that we offer at PATS.
So at this time, and I want to apologize, I didn't acknowledge Destiny Terry. She's also a community health worker, and she's in Danville. I do have a few brochures, and I will leave those with you all. And then at this time, I'm gonna turn it over to Ms. Sandie Currie and Ms. Consuelo Price.
Before they start, I have a question for you.
Yes, ma'am.
The vital records, is that if you were born in Virginia, and
Yes.
so you can't get other states?
No, they have to be-
Everything has to be Virginia based?
Yes,
Okay,
state of
yeah.
Virginia.
All right,
Any
that's
more
what I
questions?
wanted to know.
Yes, Mr. Dennis.
We have a number of issues we've discussed in the past with the Wellness Coalition is transportation, as y'all discussed. How do we work together with paths to where it's not just y'all, but because we have people that need to get to Lynchburg, just like y'all now, for that, Danville, other areas, how do we coalesce together? How do we work together so that we can help out more of our particularly underserved individuals? A number of people here wanted to go to Roxborough, Durham, Raleigh. How do we work together to do that? It's not something to answer now, but it's something for y'all to think about. Because transportation is
It's a major issue
across the board.
Right, everywhere we go.
And we can't do it separately. It's just not gonna work. We need to figure out a way that we can work this together for multiple sets of our
Well,
constituents.
I know for some of our patients, we do have that pass, if they have insurance, which a lot of people really don't know, but some of the insurances do offer transportation services. So that's something to look into, if they do have insurance, they're able to call and see if they have that transportation benefit with their insurance, and they can give them the number to the company they work with for that, and they can set them up with transportation, and they do carry them other places outside the area.
And we do know that, Lake Country, but it's within those city limits. Lake Country has, bus in South Hill, that they will transport, you can pay like $1.50. They'll take them to the grocery store, Walmart, places like that, but it's within the town limits. And then Halifax, Lake Country also have that bus, but again, it's limited how far they can go. It has to be, around in town.
Right.
They do, so that's two, but that is an issue that we hear everywhere we go, and we know for ourselves that that is a big problem, trying to get adequate transportation for people to, get to these resources that we are trying to offer them.
With VDH possibly, because we can work together to help write up the information for a grant to provide some buses, particularly handicap buses. I mean, I work along with disabled vets. And our problem is guys who are assigned to Richmond, guys who are assigned to Durham, Danville, and a lot of them now are elderly, or that they're not able to get themselves around. But it's not just them. We have other families with children in there, that they have to go to Danville, or they have to go to Roxborough. So we're looking at is there an opportunity for us? Because we can say, okay, those families going to Danville, we can take you all and try to get your appointments on Monday. Because I'm sure Pat's and others would work to say, hey, the people out at Clarksville are that, we'll try to get them out Mondays. Tuesday, we could take the thing to Lynchburg. Wednesday, maybe right, in other words, look at where the demand is. But see how we do that. In that way, it's not just y'all, it is a group working together to see how we make that work.
It's saying it in the, administrative field, so they.
You can move over here if you want, take your laptop, it's gonna.
I do have these some shoes on the.
Oh, yeah, absolutely.
Saying that.
I'll take one and pass them around, take one and pass it around. Thank you.
I would just say that it is an issue for all of our rural counties. Transportation is a major issue. In Danville, Pennsylvania, and they partner with Castle County, there's something called the Health Collaborative. And they have actually started a transportation task force in Pennsylvania County. They did go to visit Mount Empire to see about a grant that they received for their transportation. And there is some state and federal funding for that. So you have a coalition here that's very similar to the Health Collaborative. And if you want, we're more than happy to share all of this information, but that might be a place to start. One of the very first things we did was put together a brochure that provides a list of all of the transportation opportunities that currently exist, because many people did not realize there were certain opportunities. Sesame raised a good one, and Barbara as well with the big countries. So that might be a place to start. There's no easy answer on that one. That's a really tough one.
You said that the Health Collaborative put together a task force and traveled to where?
Mount Empire.
Where's that located?
Southwest Virginia. They were looking at some micro grants and also some transportation options there. Danville, Pennsylvania, and Caswell County is very lucky. We have a large foundation there that funds something called See the Possible trips.
Sorry, somebody in the waiting room.
Oh, just to get them in the waiting room, if you don't mind. Yeah, Liam will do that.
Oh,
Yeah.
there. So, well, good luck. Good luck with that. But VDH is always willing to sit down at the table, always willing to listen and help in any way, because that is just a major issue.
Well, it's a major barrier to people's health.
That's right.
Just like you talk about the sliding scale. I've had people who have insurance, but they can't even afford the deductible, so they don't go to the doctor.
Okay.
And I mean, if you're sliding scale, that might be an avenue for them, even though they have insurance.
That's right.
You're not gonna get it from them because they live from paycheck to paycheck.
There's some real inherent challenges even with what's existing now.
Yeah.
Just because we're rural and the amount of, square mileage that we cover. So there's no scale that we can work with. Anyway, health indicators. Dr. Billy Wooten has been, is transferring to Georgia. So unfortunately, you're stuck with me today, so I've had to take some of his information. The data we're gonna look at today came from the county health rankings, Robert Wood Johnson. That's kind of a standard that we all look at. There is plenty of data out there. You can go to many different websites. So what you see may be varying slightly, how they gather their information, who participates in gathering the information. So I shared that just to realize that there's probably some latitude in the numbers. One of the things that I really find helpful though, whenever I'm looking at some of these numbers, that to compare yourself to the rest of the state or your surrounding counties. And that is really kind of indicative of where we are as far as our health indicators. Some of the data needed to be adjusted and changed, so I'll point out some of the challenges we've had. So there's a couple of slides in here that we would probably pull. But other than that, I think it's pretty indicative of where we are. We are significantly and severely challenged in Southern and Southwest Virginia as far as medical and health indicators. So we'll just kind of slide through that. We'll start with the basic demographics. And again, we try to kind of look at some of the differences we have. Obviously in Mecklenburg, we're a little bit older. We have a higher percentage with non-Hispanic Black. And of course, we're rural. So that is it's a wonderful thing. And it also presents us a challenge as we were just talking about. We rank in Mecklenburg 105 out of 133 in the counties. So in Southern Virginia, we're doing pretty well, but as far as the state goes, they're all really not. I mean, we still have some of our challenges here. I'm just I won't spend a lot of time, but this is kind of the ranking where we're at. We're in the lower 25 percentile. This overall poor health, when they went out to do these rankings, what they did was, I think it was about 400,000 people in the sampling, and they wanted to ask people what they thought their overall health was. So this isn't really a provided number. It's just what people in general felt. And so here in Mecklenburg, 18% reported that overall they feel like they have poor health compared to 12% in Virginia. And I'll try not to read it too much to you. Heart disease, again, we're still running a little higher than the state. Adult diabetes, I thought, when we compare it to some of the local counties, Mecklenburg seems to be doing pretty well, but certainly not anything for us to brag about. Childhood diabetes rates are something that we should all be taking a serious look at. And something
That's high.
Yeah,
That's
sure.
high.
Yeah.
No, that's not a good trend.
Okay. Just kind of highlighting on our cancers. I probably don't need to read it to you, but the big one, prostate cancer. I know we spent a lot of time on the colorectal, but prostate cancer seems to be rolling. Again, Barbara had mentioned that the ARPA funding that is available. We have had a couple of very successful health summits addressing cancer. I know in one particular, we had almost 100 men coming out for an event. 20 some, and the average age was above 70. 27, I think, ended up getting, help me out, Tara, Barbara, ended up getting their colonoscopies, and 5 needed to have immediate attention. So we know that that one particular event actually did impact lives significantly.
Question.
Mhm.
I see that the prostate's very high, but how many of ours are really not reported? Because I'm having problems with the fact that everything's high except for the breast cancer. Is
So
there?
we found that kind of, well,
That's odd.
yeah, we found that. And so again, as I said, I wanted to take a look at some of the numbers, but we found that throughout. So we're actually doing a little deeper dive on that, because we found that number has been representatively low throughout 4 or 5 counties. We're going to do a deeper dive on that, and that was a great catch.
On the breast cancer side of things.
Right.
Because it just seems, it stands out as a true anomaly.
Yeah, and so I
Yeah,
wanted
both
to
of
do a
them.
little bit, again, I just kind of, as we take a look at that, but, and we'll report back to you. Thank you.
Can I ask a question about the ARPA funding? What are the qualifications, or what is the, or can you share later, like how you apply for that?
Really, for our particular district, which Mecklenburg is in Southside, we requested the ARPA fundings for events to do training and education for health-related issues and health equities. So that's something that we really focus on. So, and it looks many different ways. We partner with several churches, like Barbara was giving her testimonial. We've done public events. We're involved in a very large back-to-school event in the next week or so. And we'll be providing children's vaccinations, sports physicals, and we'll also take that opportunity to really cover a lot of the information that was covered here. So ARPA funding, the one beauty of the ARPA funding is that you will pay for food.
I was just gonna ask that.
Yeah, no one else pays for food. We don't have a whole lot of money there, but we are happy to sit down with anyone, and we'll let you know if we think it falls in the parameters, and we're happy to apply for it and give you all the details.
I have a question too. So I know that colorectal cancer rates are high for young individuals, particularly currently, and that prostate cancer is particularly prevalent among African American men. Are you factoring in those demographics into your statistics?
So these, again, they're really statistics that we've gleaned. These are just kind of a broad brush. What we're trying to do is just kind of introduce everyone to them, but there are specific demographics. If I could print out, if I take certain things, I can print out and we'll get about 10 or 12 pages. It's
Okay, yeah, understand.
really the purpose of today is just kind of, as we take a look around where we want to focus our energies and things that we might want to concentrate on. That's really the purpose here. It's not to really pull anything out or point anything out. It's more informational and educational on where we should really kind of focus. But we do have, if you have any interest, I'm happy to share the links, but they really do deep dives on just about everything. Again, I'm trying not to take up too much physical inactivity, especially when we're looking at youth. So that's something that we really try to kind of focus on, our youth activity, obviously during 62%. Right. And again, I would just, it's a high rate, whether it's in this number or right exactly, I would caution everyone to do that when we're looking at the data.
So are you all working at all with the schools? Because like when my kids were in school, there was no recess. And I mean, recess was an area where kids get activity, unless they're just going over and sitting on the swing doing nothing, but that was Charlotte County, but I don't know if that's still going on.
Yeah, that
Or not.
I couldn't answer.
Yeah, me too. I didn't do things just back into the group because of COVID, it kind of.
Does
Right.
anybody have small children on the call? Because
This was,
I know I had, did they have recess?
Yeah, they get recess and then they do gym as well, plus recess.
Yeah.
well, that's good. So maybe that's outside of school, they're not getting any exercise?
Yeah, I think a lot of it is the focus that they go home and they're on social media and they're gaming and they're on their video games. That's no one, yeah, I haven't decided anyone to go on up, you know, that kind of thing.
Right.
But as far as partnerships all, you know, it really depends. We have a good partnership with schools in Danville that we started, but that's really focusing on different health indicators. And I think the school boards drive a lot of this during the individual schools, and schools are somewhat like a federated state, so it's also driven by your principals and all. One thing we don't do well is excessive drinking, so that's always been a good highlight when we're taking a look around, which is surprising to me, but for those of us who drink some wine. Smoking as we expect, because we're in tobacco region. Vaping is a real big issue for our youth. STIs, we're actually not as high in Mecklenburg as in some of our other areas. In Danville, the numbers are really quite a bit higher, but we're still not anything to brag about. In Birch, we're at 3% versus 1.5. And that's 15 to 19. That does not include our under 15-year-olds. Food insecurity, and I'm going to turn this over to Consuelo. Oh, she's declining. That's because y'all are such a tough crowd here. As Tara said, she spends a lot of time delivering food. We also have another person in our pop health team that's really focusing on our food deserts, because obviously in Southwest and South Virginia, we're all kind of a food desert area. Overdose deaths, I think our numbers finally are reporting for BDH are trending down a little bit, which is good news. Premature death, again, kind of an indicator of our health styles, things that are available here. Accidents, I was very surprised when I was doing a little deeper dive on one thing. Accidents seemed to be high, not just in Mecklenburg, it was just looking around. I thought that was kind of an interesting number. Infant mortality is very unfortunate. We have started a sexual health task force, maternal sexual health task force in Danville. And then if it goes well, when we do, we're have some success stories and things we're looking at, we want to then carry that through our different counties.
Where are you going with this piece of that? Why do you think it's over double?
Infant mortality?
Yeah.
I can share anecdotal conversations that we have, especially with PAS, but we have with our teens and moms, a lot of underlying medical conditions, health conditions, diabetes, obesity. I know that there's a challenge sometimes to PAS. They'll mention that we have a difficult time seeing folks for their prenatal care, especially the younger people. Some of our younger people don't even know they're pregnant. So there's a lot of contributing factors to that. And I can only share anecdotal. Unfortunately, I'm kind of more of a messenger here, but I think that there's a lot of contributing factors here. And again, we're in rural areas, we're in impoverished areas, we're in the desert, and our health indicators are obviously running a little higher than the state. I'm sure this is kind of a challenge for us, doctor access. The numbers were obviously very difficult. I know we're all facing big challenges getting healthcare providers in our rural areas. And wait till you see dentistry.
So
Dentists.
I guess one of the other things being I'm looking at is when you look at our numbers and the Virginia numbers, that means that as high as ours are, somebody else has got to be that much lower to bring that number down. It's just something for us to consider when we're looking at this, just how far we are from some areas that are able to do.
In other words, you can't just take our number and compare it to an average, you gotta look at that.
Yes.
There's somebody out there going 701.
Yeah.
Yeah,
Right.
probably Charlottesville, Richmond,
Exactly.
Northern Virginia.
Right, but again, it's something that we have to look at as to just how far apart.
And that's why I
It's
caution
fair
folks, when we're looking at data, I caution people not to jump to conclusions and not to just kind of interpret things, to really, you have to take a deeper dive. If we're looking at just that median kind of number, an average, it really doesn't tell a whole lot. But also it works for and against us that are, as what you put forward, the facts you put forward. It's true. Dennis, has, thank goodness, also provides some dental support, but they are really overwhelmed. It's been a really tough time. We just came off of the RAM clinic that was held in Emporia, and we saw a lot of folks from our region going in for dental care and oncology care. Just as a side note, that dental health has played a very important role in my life. I'm sure for this group, it's not a surprise. We do pretty well in the preventable hospital stays. What does that mean? Well, here you go. I think a lot of this is when we're taking a look at, again, it's interpreting the data when we're looking at a lot of folks are using ER for an emergency room, so we already have something playing in there. If we also exclude the 65 and under population, that's kind of where we probably see an increase in the stays. Again, I think a lot of this is somewhere in the reporting of it and how it's reported and how it's documented. And I would caution everyone about making any kind of judgments on it until we did a deeper dive. And I know we have a lot of focus on that. I think that that's very important. I know with BCU, they're very active. UVA is very active as well, especially because we're in their region. But again, I couldn't tell you why. And then this is kind of general information. And then this is where I was telling you about the accidental deaths. I always found that was a little interesting. Slips and falls, driving, that kind of thing. So, and I appreciate your time. I wish I could be more helpful in interpreting the data, but I'm just really kind of here to present it. But it certainly gives us a place to start our conversations and what we should really kind of focus on.
Sandy, I did got a quick question. Like how VDH partner in with the schools and everything, and how she was talking about like the recess, she didn't think it was doing it. Do they partner in with like VDH probably do like funding for long-term programs like in the schools? For instance, when I was in school, they had like the masonry, you know, those programs, you know, all of those things that help kids when they graduate. Because like some of them graduated and had no sense of direction in which to go, but in school, they used to have the programs where they did masonry and different things like that.
I don't know of VDH involvement in that. There's all kinds of different grant money and grant funding. I can't really speak to that. Unfortunately, that's kind of out of my area of expertise. But I also know in partnerships with the schools that your local school boards and your superintendent and the parent involvement really kind of drive a lot of the decisions in schools. But yeah, I wish that VDH were kind of the be all and end all answers to these things, but I think all we are is just like you all. We're here trying to do our best and provide resources. Thank you. Thank you. Thank you. As well as going to present next time. Don't be so intimidating with her. We just want to welcome you with a question. And we appreciate it.
Very nice, very nice.
All right. I did notice one interesting thing. The instance of breast cancer screenings was high in Mecklenburg County, which may attribute to people finding stuff early and maybe an anomaly, but
We need to know the makeup of the audience. Yeah, we need to know the demographics. So that's why I say to not interpret it. It's just something to give you a basis.
But I'd be more concerned if that number was double low, just like that was way low.
Right.
That would be like, that doesn't make a whole lot of sense.
I have people in Actually, I don't remember whose website it was on. Wait, but that's really. That thing pointed out 25%. Way over.
All right, I'm gonna read the comments here. Lana said, thank you so much. I can't speak highly enough of Paz. I think y'all are wonderful. Also in the chat box, awesome presentation, said Jeanette. Anyone else online want to chime in with questions, comments?
Yeah, Kenan, I did have one. Great presentation. Thank you all so much. And thank you so much for doing the work to kind of pull all this data together. I know that that was no easy feat. I did just want to know, I know in my sector of work, a lot of the folks that we see with overlapping and chronic health conditions also at some point or currently experienced some sort of substance use disorder. I just wanted to know if that was an intersection that you all were tracking or had been tracking or were planning to incorporate at any point, specifically around the dentistry aspect and the access to those kind of services.
As far for our districts, again, I would have to kind of check. I'm not aware of any, but I can also share, I know that PATHS and some of our other providers keep very detailed records and report out on information, and they may have something such as that. But it's at any time there's a question like that, we're certainly happy to try to do some homework and see what's available.
Okay, great. Thank you.
Good question, though.
Any other questions from folks online?
I don't have a question, but I really want to say again, I know, a lot of work went into getting the presentation together and revisions and all of that. So I do think it's an awesome presentation. And I do want to say, I'm on that team. That's all I want to say. That's all I want to say.
What happened to our?
We're in the room, Jeanette, we're in the room. And we outnumber y'all.
What happened to her being outdoors?
Oh, she got too high. Oh, yeah, she's on location.
I couldn't last. I'm the first to admit I tried.
And I want to do a shout out to Jeanette because the whole start of the presentation all began with Jeanette.
Oh, awesome. Thank you, Jeanette. Yeah, thank you. Yep. She's secretly outside in her car, Liam, so we count her. All right, so back to the agenda.
Okay, yeah, I can pull that up.
All right. Do you want me to start going down to the event? Oh, you tell me. Okay.
But it's okay. We can just go in order if that's cool with you.
All right.
So I can start, and I invite the other leadership team members to fill in any gaps I missed. But we were able, the big update from the leadership team is that we did have our leadership meeting last week. The big items that we discussed are we are bringing Paul Short back in to offer some leadership coaching. He's going to do some cool things. He's going to do some one-on-ones with me and one-on-ones with each member of the leadership team as well, and then do some general coalition building. So a really exciting opportunity for all of us to get some very personalized leadership training, which I'm excited about. Also, I think will help inform the direction of the coalition as we head into the 2025 year. Many of you may be familiar with Paul. He's done a couple of things for us in the coalition. Most recently, he did a entire leadership team building retreat in January with our brand new cohort of leadership team members. So really excited to have him back on board. Invaluable expertise, and I think it'll be a great opportunity for everyone. Also, just to note, something that he may be interested in is reaching out to general coalition members, particularly those who used to be on the leadership team, just to understand a little bit more about the history and what the general members want to see too. So just noting that for y'all. My first meeting with him is on the 25th, so I will have more direction after that meeting. Elena, Jeanette, Kenan, any comments on that before I hop to my next topic?
The only thing I have is just to go through the events that are coming up, but I can wait to do that later. It's up to you.
Okay. Yeah, if you can go through the events if you'd like.
Okay, and I've got, I'll pass around a copy in the room and then I can email them to people as well. Let's see, I'm gonna stop your screen sharing.
Okay.
Okay. There we go. Hang on one second, let's open some stuff up. I'm not gonna show that, hang on one second. That slideshow out of my way.
Click on that thing to exit. Up top.
Yeah, and I'm looking for it. Oh, there it goes, there it goes. Okay. So the first thing to share is National Night Out. We do have folks signed up. We are in all 4 counties. If you all can pass this around the room and make sure it comes back to me. This is what's on our monthly newsletter that went out Monday, is on our social media. We're gonna be in 4 locations on August the 6th. We do have a table and tent that'll be set up next to Southside Behavioral Health. You can see by the flyer on the screen, or it's going around the room, we do have a QR code to register. Or if you don't like to do that, you can just email me, at prevention or ksmith at Southside Behavioral Health. We're gonna be in Brunswick County, Halifax County, Mecklenburg County, and of course, in Mecklenburg County, there are 2 locations. When you register, it tells you, what time the setup is and the cleanup time is, and frankly, it's just a half an hour before it starts and ends. And then we do have folks so far at each location representing the coalition, but we would love to have more people there. We're putting together materials to be there. I do have Southside Behavioral Health staff helping with the delivery of those materials. So that, you know, we're asking people to come and set up. All right, that's all the comments. Any comments, questions about that event? What's coming up on August the 6th?
Like if I want to do, South Hill, how do I sign? Because I reached out to the town of South Hill, but they haven't responded to me. How do I sign up to do a,
To do your own table?
Yeah.
Do your own table? Let me write that down. I can do a deep dive in my email and see who that is. I can't tell you off the top of my head.
I probably, town council, and she gave me the email for the town of South Hill, and I reached out to them, but no one has responded yet.
My gut is telling me, I think it's a South Hill police officer. But the name is not coming to me at the moment, but I can make sure I send it to you. I could do that. Sarah, our marketing coordinator, is coordinating all this for us, and I know that she and I talked about, she's got all the contacts. I can get it to you. That's no worry. And you just want South Hill's contacts? Okay.
We have representatives going to Cheyenne City and.
Okay, you just want the South Hill one. Yeah, I think my gut instinct tells me it's a police officer on their, police officer that's coordinating. Every year, sometimes it changes who coordinates with each location. All right,
Kenan,
any other?
Shelley put it in the chat for you.
Oh, hey, it's there in the chat. Thank you, Shelley. It's Deputy Chief Geist. Is that how am I saying it right? So it's GGEIST.
At southhillpd.com.
Yep. Let me write this down. I'll look at it. Can y'all see that? EIST.
Ask and you shall receive.
That's right. Thank you, Shelley. You guys have to turn your microphones on whenever you want to. I'm over here digging, trying to think about, so I was right, it is the South Hill Police Officer. Oh, Deputy Chief, I'm sorry, Deputy Chief.
Thank you, appreciate that.
Chief Geist. All right. Awesome, thank you, Shelley. Any other questions about National Night Out? Hope to see everybody there. All right. Let's see. The other events coming up. I wanted to share, let's see if this is the one. Yes, all right, let me see. The next event for you all to be aware is in less than 2 weeks. And I'm sharing the Spanish language version. There's also an English version. This is not an open event to the community. This is an event that we worked on with Wallbridge Construction on the Microsoft lot in in Boynton, Wallbridge Construction. We are traveling to the coalition members in Southside Behavioral Health and all of these other wonderful partners. Fantastic. And we can add more people to this, by the way. On the 31st of July from 11:30 to 1:30, we're going on to the Microsoft property onto Wallbridge Construction's location. And we're going through their safety gates and we are setting up a resource fair. And let me get the other, as you can see, the resource fair is focused on Hispanic and Latino resources. And so this is not shared publicly because it's a closed event, because that particular construction company has 600 employees. So during their 2-hour lunch cycle, they're going to be able to walk through a very large tent. You can see they're going to be getting resources available in Spanish from all of these agencies and partnerships, English and Spanish resources, as well as you can see down at the bottom right-hand side of the screen, we're going to be doing rapid revive.
Who's doing it in Spanish?
And Spanish. We're going to have translators on site. We're expecting 3, really, in my spare time. We have 3 translators scheduled to be there. You know, we always got to do more than, but we got 3 that are coming right now to help us with that. So there'll be somebody there to do that. It's not an open event to the community. We do have to give names of who is coming through the safety gate onto Wallbridge Construction. These are our partners so far, but we are still looking for more. If you'd like to join us, if you have any resources in Spanish and English as well, please let me know. Would love to update the flyer, send it back to Wallbridge. Each time I send them a new flyer, they get super excited with all the folks that are coming over there to join them. When I say a tent, if you've never been there, it's not like any normal outside tent. It is a tent.
It's a building.
Yes, and they have bathrooms, and it's not gonna be air conditioned, I would imagine, so, you know.
It's warm,
Yeah.
but it's not, it has AC, but it doesn't keep it warm.
The same
Cold.
one we went to.
Yes.
Probably just in a different one.
Yeah.
So if you can join us, we got some other.
Kenan, when do you need names of sponsors that employee?
Oh, I need to give her the names of anybody coming on through the gates by Monday at noon.
This coming Monday?
No, the Monday of the event. So it's the 31st, it'll be the 29th. Yeah. Monday, July 29th. I'm gonna reach out to everybody this coming week to see, hey, I need your final list by Monday morning, and I'm gonna give it to, email it to Felicia by Monday at noon to put on a list at the security gate. And so when you arrive in your vehicle, because not everybody's gonna arrive at the same time, arrive with your vehicle, you have to tell the gate what is your name and where you're going. And then if your name is on the list, you'll be admitted. If not, you won't. That'll probably be some texting back and forth between Alicia and I. All right. So if you're interested, that is a fantastic event to participate in. This is the other version of it that also got shared. There we go. Oops, one didn't share. Did it work? Oh, yeah, it did. It worked. There we go. There's the other, again, going out to all staff on their large 600 employee staff coming to do rapid revive. All right. Okay, let's see. Let's see. I'll pass it off to Allison. I have one of her event flyers as well.
I think she hopped off, Kenan.
Oh, did she? My bad.
Yeah, she had to go at 11.
All right, let me, oops, let me bring
But she
up.
put her flyer in the chat.
Yeah, and I've got it right here. Absolutely. Oh, and I've got one in the room. Because I'm always multitasking, right? All right, here's the flyers. They're not public, but these are the flyers that went to Walbridge Construction. Here's the flyer for Allison. All right, Liam, did you want to talk to this flyer?
Sure, I don't have it on my screen though. Would you mind sharing it?
Oh, my bad. You're right. It was on our screen. Sorry. All these documents, I love it. I love it when you have so much to share. My brain just kind of goes. Everybody in the room is being really patient with me with my multitasking here. There we go.
All right, thank you, Kenan. As Kenan mentioned, this was a resource shared from us to us from Allison with the VA. It is a Suicide Prevention Month resource fair. It's coming up on September 17th from 11 a.m. to 2 p.m. It is going to be in Richmond. There's going to be experts there talking about suicide prevention, and the suicide prevention team is actually going to be on site. There are also going to be tons of community organizations that are local to the Richmond region, but also statewide. They're going to have a lot of veteran support resources and giveaways that's specifically targeted to organizations. So, if you are going or you want to assemble a team to go as a part of an organization, you can get enough resources to share out in your physical building or wherever you share resources. And also they're going to have persons with lived experience or veterans who, have experienced some difficulty with suicidal ideation or suicidal thoughts. And they'll be on site to talk to folks and just share their experience and hope, share a little bit of hope for folks who may be in a similar boat. So if you are interested in going, please let Allison know. We can put her information in the chat. Let me see. Okay, I see down at the bottom, she's added some information. So we can make sure to put that information in the chat. We'll also send this flyer out with our notes. So just a heads up on that.
Yeah, the flyer will go into our next newsletter as well. I submitted it to Ellen yesterday.
Perfect, thank you.
All right, that's jumped into September, so I'm gonna step back with one of our March events that we are sponsoring. Real quickly here. We do need coalition members to attend. If they're interested, we will take care of the registration. It is in Danville, so there's no overnight accommodation. But if you're interested in attending, let me get it up on the screen. There it is. It's the RACEAP conference on Wednesday, August the 28th. There's a flyer around the room. If you're interested in registering, just contact me so I can get you registered, put you the registration link.
Yeah, you can go and register.
It isn't all day. Are you going? Are you telling me that?
Yeah, I already had it in my calendar.
Oh, you've already registered?
I haven't registered yet.
Okay,
but,
write that down. Okay, marijuana conference, August 28th, 9 to 4. I imagine it does include lunch. We're
usually
the
does. The
coalition
same place
well.
they always do it. so.
Okay, anybody else interested? Don't have to tell me right now, but if you want to, you can. Anybody online?
We have a table.
Oh, you have a table. Oh, cool. You have a table? I should talk, okay. I think they're.
No, a table resource.
There.
Right.
Oh, awesome. We should do
Not a
that.
table for.
We should do that. I'm thinking about, I think we do
Talk
too.
about that.
We should check on it. Check on our table. Yeah. All right, so we're all going then. That's exciting. We're all going. Okay, well, a little redundant there, my bad. But if anybody else isn't already going, if you want to go or know someone that you think should go, someone in the community, like we talked about, school board, parents, who's making all the decisions in the community, let folks know about it. All right. Okay, and then real quickly, obviously coming up with September being Suicide Prevention Month, which with Allison's flyer, we have multiple other events coming up. I'm gonna pass them around the room. We have assist training that's gonna be happening at the Estes Center. I'll send you a number of copies. I just accidentally made one I needed, right? We're sponsoring 2 Revive trainings with the Southside Medical Services Corps. Y'all know Amanda Hutchins, I'm sure, now one of your Revive trainers through VDH. We're helping her out with providing Narcan at her events. Those are 2 of her flyers. She's doing trainings at the YMCA, both South Boston and Clarksville. We have, virtual Revive training coming up throughout the area as well. And the ACES training that's coming in September in local church. And so Liam, let me throw those up on the screen for just a minute. Just trying to multitask a little bit
Are
here.
you doing any of the longer classes on like
Assist,
suicide?
yep, that's the green one, that's the green one. And we're also doing a Safe Talk training, which is a 3.5 hour, but I don't have the flyer ready yet. We're also launching, 7 or 8 mental health first aids that'll be going on between September and December. I just don't have the flyer yet. So the marketing team's still working on all these flyers for me. All right, so on the screen, let me show real quick. Amanda Hutchins is working with us to, let me get these up on the screen. So the Amanda Hutchins from the Southside Medical Corps, which is also VDH. She's hosting 2 Revives, one in August. Well, the August one's in South Boston, and then the South Boston one is in September on the 17th. Everybody should see this. There we go. There's the September one. And we are supporting her. She is the trainer and I am her helper. And we're providing the Narcan and the kits to support her with that. So there's her flyers. Aren't they cool? All right. And then we are still as a coalition continuing to provide the virtual options. Here it is. This is the virtual schedule that's going to be going out. You've probably already seen it on social media. The virtual revives. This is for the next 6 months. We're doing lunch and learns. We're trying to capture people at the noon hour, so you can actually like bring your lunch to your desk, hop on my Zoom and get Revive trained in an hour, right while you eat your sandwich. Right? What easier way to capture people for the next 6 months that can't come do it in person? Liam, I see Liam chuckle with that. But it's true, it's true. We're trying to get more people virtually. All right, and then so much happening. You guys are fantastic. Let's see. Oh, the assist training, which Catherine just mentioned that in September, we are planning to do the Estes Center is graciously offered to host some suicide prevention trainings there. On the 17th, there's going to be a Safe Talk, which is a 3.5 hour suicide prevention class. Who doesn't have 3.5 hours to learn some soft skills around suicide prevention? But then also later in the month, September 25th and 26th is the 2-day assist training. That's safety planning. It will be at the Estes Center. That is a deeper dive into how to help somebody that is suicidal, but you're going to be their point of safety until the next level of care either arrives or you get to the emergency room, but you stay there with that person. And I say to people when we teach suicide prevention classes, if you don't have these skills and to talk to someone who's in a crisis, then that is not what you should do. We should connect them to 988, 911, someone who is trained. And assist training, that's a deep dive, 16-hour safety planning training. That does give you the skills, whether you're in a church or a school or in your home, to know the language of how you talk to someone who's in crisis. Right? So, and these are the soft skills given to folks that don't have the EMS, first responder, law enforcement type of training that those folks have. And it comes with breakfast and lunch because it is a very tender training. We don't allow you to leave through the course of the day. You do have to remain there with the clinical trainers both days for 8 hours. Be there for all the time, or to be certified and be on our list of assist trainers. But we recommend that for churches, everybody. Not everybody wants to do that type of care, right? That's Safe Talk would be for those that don't want that type of care. But if you have a heart for that, assist training is an opportunity to be on that level of need to help folks. So that's in September. And then we also have some mental health first aids that month that we're gonna be advertising as well. But I don't have the flyer for that. As soon as I do, I'll get that out on social media and I'll have it ready for the next meeting in August. But I'm just excited. We've already got things lined up with community partners for September. All right, and I think that might be it. So let me check real quick just to make sure. Oh, the ACEs, we also have an ACEs, that's in September, coming up. Super excited. Talked to the leadership team of this church a few months ago. People want to, again, ACEs training. This is open to the community. A flyer just went around the room. September 28th, we're gonna be at New Mount Olive Church in Halifax, right off, Old 360 Mountain Road. A 3-hour ACEs training. That includes some refreshments, that includes breakout time, includes lots of videos. It's the virtual 3-hour that we created during COVID that's now an in-person version. Stevens helped with that. Kelly Colgate's helped with that. Dr. Crowder's helped with that. Anyone's welcome to join there as coalition members to talk to folks for 3 hours as well as attend the training. Super excited about that possibility coming up. All right, and Liam, I think I've any questions about any of these items? Everybody get a chance to see the flyers? All right. If you want flyers to post, email me out, send you the link. You can run them off on your color printer. My color printer is not real sophisticated, so I don't do that many unless people request them. I get in trouble for burning up the color printer. I gotta be careful. All right, so you see light refreshments provided. We'll have some munchies there. All right. I'm sorry, Liam, back to your agenda. That's our events.
All right, thanks, Kenan. Hopefully everybody can see that. Y'all can see my screen okay? Cool. So the only other leadership team updates I have, so our big focus is really rounding out the year with our events. We are going to be partnering with our Ticken in September to do an Around the World in Chase City. It'll be a passport event for folks to get stamps on their passport for accessing different wellness resources. And so the Ticken will be present, the coalition will be present. We're also going to be partnering with Will Stimbridge to do a drug take back event. He's been working really hard with the DEA and other partners to organize this event. That's coming up in October. I'm still waiting to hear back on an official date and location, so I'll keep you all posted, but that is moving forward. And then also the Lean In Project, Southside Behavioral Health is moving forward with the We Stand Together Summit coming up in October. The coalition will be a sponsor or will be a supporter of that event. So currently we are in the process of negotiating a budget with the Department of Behavioral Health, as they are one of the lead funders of at least the educational part of our event. So our final negotiation is due tomorrow. And then hopefully we will have an answer as to whether we receive funding by early next week. So those are the big leadership team updates. Again, just want to reiterate, folks who are available, please come out and support us on National Night Out coming up August 6th. Elena, Jeanette, Kenan, anything I missed from the leadership team?
Sounds good.
Nothing that I can think of.
Yeah, other than the flyers that'll be ready to come out for those events, as soon as we have them, they'll start circulating.
Great. Oh, and I did forget to mention, we do have a one-pager that we can start circulating for the We Stand Together Summit. So if any of you are interested in a PDF or a printable version of that, please let Kenan or myself know and we can get that over to you to start circulating now. Otherwise, we did our National Night Out update. Kenan, have you received any updates from the TARP?
No, other than, yes, Christine and I talked the other day about, getting the, flyer ready, negotiating that with marketing and to, order some more materials for that event.
Okay.
And who has, somebody had my National Night Out flyer, I wrote on the back.
Yes.
Can y'all pass that back to me? Yeah, okay, that's cool. I took notes, you can take any of the other ones, but this one I would put notes on the back. If I write notes on the back of something and. All right,
Y'all don't be stealing Kenan's notes now.
no. They can take cookies, but they're not taking my notes. All right.
Okay. So Elena, any updates from the COC since our last call?
Oh. All right. She's got something in the chat box.
Oh, sorry.
That's all right.
No.
She says,
The next COC meeting is going to be August 9th at 10 a.m. It's going to be at the Tri-County Satellite Office on 900 John Randolph Boulevard in South Boston. So for the folks who are newer and maybe don't know what the COC is the Continuum of Care. It is a HUD or Department of Housing and Urban Development mandated coalition of folks who are dedicated to reducing homelessness and reducing the time spent homeless in our community. They are managed by our State Department of Housing and Community Development. And so if anyone's interested in joining the COC, as it really is supposed to be a community effort with lots of different agencies to provide resources and support, reach out to Elena. Or if you need more details on that meeting for August 9th, just let us know and we can make sure we get those to you.
Also, I wanted to let everybody know, if you know anybody who wants the coordinator position, we are opening up a job opening for a coordinator of that coalition. So if you have anybody on your Rolodex that might be interested in being that coordinator, I don't know that it's posted yet, but it should be out on our website, tricountyva.org, under careers.
okay.
If it's not there, it'll be there soon.
Okay, so COC coordinator for the
COC
for the
coordinator.
coalition. All right, awesome.
And Catherine, I'm happy to offer any support if y'all get, if you need any support around building that or building the resources out.
Okay, thank you, Liam. I know that was your job at one point, wasn't it?
Yeah, but that's also a lot of what I do on a higher level day to day too, is build out COC resources. So happy to help in any way.
Great, appreciate it. Thank you.
All right, and if you'll pull down the agenda, there's some more items on there from your end.
Great. Oh, hold on. Let me check the chat, make sure I didn't miss anything. Okay. Elena says she doesn't think the position is posted yet, but it should be very soon. All right. So next up, we have our update on veteran outreach.
Yep, Dennis? Oh, Dennis, you want to introduce ourselves? You want to introduce yourself? Okay.
I'm Dennis Daniels. I normally work with the veterans here in the local area. A couple of updates. I haven't talked to Pat yet, but I probably should have. What I'm putting together right now is a package for Microsoft for building out Palmer Point Recreational Area as an all-inclusive Bugs Island Park. So the swimming area, we will be getting beach wheelchairs with the big balloon tires for those people in wheelchairs. Again, we're predominantly doing it from our side for the VAs and the veterans, but we've already contacted in Southfield Feet. We have contacted some of our families with cerebral palsy from Secures out of Richmond. We've contacted families with both multiple sclerosis and muscular dystrophy. What we're doing is looking for those families to give us letters of what it would mean to their families to have that as an all-inclusive park. It will change the bathroom, it will change the park to where the pathways are all wheelchair, more than just ADA, but completely wheelchair and accessible. We're putting in an 80-foot gangway and a 40-foot handicap dock at the end. It will also have handicap canoe and kayak launches. There are canoes and kayaks with outriggers that will be posted there. So from other organizations, if this will impact your constituents, I need you to provide me letters because we're working together now. We've got autistic families now in Granville County that are also submitting how this is going to impact them from the North Carolina side. So it's not just us, but we have the Richmond VA, Durham VA, Danville, of course, the Salem VAs are working with us. But we just need how this will impact as a community as whole. So for PATS, I know y'all reach out and have a lot more statistics and stuff for those families with needs that may be able to put together what that would do. Again, it's recreational therapy. It has helped our veterans. We already have Island Creek. So it is a way to do that. I will see whether on the assist training,
Okay,
check with them. How much of that too, do they have additional time or additional spaces? Because when we interact with our veterans, we have to use at times slightly different language.
okay,
They, for some reason, we react differently.
sure,
Under time
absolutely,
stress.
absolutely, absolutely.
So again, you know, if we can, we'll put people there. The other part is I will have a flyer for y'all, but we will be the next outing for the disabled veterans from Danville, from Richmond, from Durham, Granville County, and the rest will be September 18th. It'll be over at Eastland Creek, a fishing pond. We do our September is fish fry. So if you have any disabled veterans, those that would like to come out, they will fish at a well-stocked pond. The pond has bass and brim. They'll be able to keep whatever their biggest fish is. We'll be happy to skin it for them. They can, you know, we'll fry it for them. If not, we have already almost 80 pounds of catfish and other fillets.
Wow.
And then in October, we'll also have a flyer once we get the dates on that. We will be at Palmer Point and we will have the families with special needs. We'll have wheelchair families, we'll have autistic families. That is always on a weekend. So that's usually a Saturday or Sunday because again, this is a family event and it is hosted by veterans as our outreach for those families because we take care of our disabled vets. It's an easier way to reach out for our community to do the same thing for those families with special needs.
And you said that's September 18th for the one at Eastland Creek?
That's, will be at Eastland Creek.
September 18th, okay. And I'll follow up with you. There is a Swiss train specifically for those that served, for veterans.
Please do that.
I'll reach out.
I'll get-
Okay,
Because I probably need to, and we'll see if we
Yeah.
can't get some others involved.
okay,
So that when you get a call here in the local county, you have some of us trained
yes.
that can respond for a second.
Okay, I'll talk to you about that off call about Sarah Price is the coordinator for VA, the Veterans Administration. They have folks that will teach a veteran-based
Right.
assist. And we can put together one,
Oh, yeah, because I'm sure between Allison and all the rest of them.
right, okay.
We need to make that.
We do, we need to
coordination.
make that happen. Okay, we'll talk about that. That sounds great. All right, any questions, comments, follow-up on what Dennis reported on veteran outreach? Okay, I'll jump to Sokoba Summit. The registration is finally open. It opened, I think, about 3 days ago. So I have submitted the names of those coalition members who were attending. It was in last month's minutes. You guys have it. It's in there.
Yeah, Christine, Elena, Will,
Yes,
myself.
they're all, yes, as soon as I have their accommodations ready, then it'll come out from our travel coordinator, so that's a go. And then I think, Liam, we don't know yet whether we're presenting at Sokoba as of yet.
They are still actively looking for presenters.
Right.
Yeah, so we are on the official spreadsheet. We realized that there was a miscommunication around the proposal submission. And so we did get our proposal resubmitted to them. So the last I checked on the spreadsheet, we're still there in consideration, but we have not gotten a formal approval.
Okay, Stephen, any follow-up with that?
Outside of that, a lot of their meeting this month was, of course, regarding the summit. An interesting thing, though, they are currently looking for board members. I guess it's that time to replace. But the interesting twist on that is, one of the things that they're looking for is people who've never done that before. If you've never served on the board for an organization, they're saying, come and use this as a learning tool for how to do that, so that you can learn and go on to join the boards of other worthy organizations down the road. And I thought that was interesting. So if anybody's never served on a board of directors and you want to learn a little bit about what that's like, throw yourself under the bus and have at it. But I just thought that was an interesting and really neat twist on that.
Well, I was on their board back, I think, before
A couple of
COVID.
years ago.
Yeah, I was on their board. I loved it. Great people. You get to see and experience different parts of Virginia. You get to work with folks. They have retreats and you do meet pretty regularly. They made me their secretary. That was a tough job for me. I ended up having to step down only because of other obligations here, because that is a state position, serving with Secova. But I mean, fantastic people. I mean, can't tell you how much. I was so sad to say that was one thing I did have to step down from with COVID and such, but great people, great opportunity. Well, you know, you're there every month with them. They're fantastic folks.
Yeah.
So it'd be wonderful if somebody on our coalition wanted to serve on their board. I mean, I did it for a bit. It is fantastic. I loved it.
I gave it some thought. I've served on other boards, so but I think I did give it some thought, but I have other things outside of that going on right now, and I don't know if I could serve it well.
Okay, we'll put it in our minutes, see if anybody's interested. They can
But
reach out to me and
that was great.
talk to them about what it's about. I think it'd be great. It'd be great to have. Yeah, I loved it with my time on there. All right.
All right, thank y'all. If nothing else from Secova, I'll turn it over to the general members to see any news updates y'all want us to share.
Announcements, you ready?
One thing this weekend, obviously it's Lake Fest here, but also in Halifax, Tri-County is doing the first annual Glancy Spain yard sale. $12 for a spot if you want that, but please share and come on out and see what the people have to offer.
Okay.
So that's to raise money for our domestic violence program, because Glancy Spain was a big supporter of our domestic violence program.
Okay, awesome. All right, I've got that noted. Other announcements in the room or online? Anything you'd like to share?
Elena put in the chat that the yard sale is from 8 to 12.
Got it, thank you. Got it. I love our little hybrid team. I love it.
I have a couple of things.
All right.
All
Jeanette?
right. So, on a personal note, since Lake Fest was mentioned, I will be at Lake Fest singing with the local group on Sunday. So that's going to be fun. And again, on a personal note, I'm involved in a project that is looking for people with addiction recovery life accounts that they can share with the community. And I know we had someone on here a couple of months ago that was in recovery and sharing. So those stories are looked for, and they answer a couple of questions like what led them to recovery. What would they say to encourage a family going through with someone in addiction recovery, to put those stories together to share with the public because we're losing a lot of folks to those overdoses and maybe not having hope. So we're collecting those stories by answering those 3 questions by July 31st. And hopefully they'll be published before Recovery Month comes in and before Addiction Awareness Day, August 31st. So if someone's interested, please contact me. Thanks.
Okay. All right, I got that in the minutes. Your contact information. I got it. All right.
Okay.
Okay. Other announcements? Any other announcements? Okay.
You already did your training announcements, Kenan?
Yeah, pretty much.
Okay.
Well, let's see.
Wait,
Oh,
August,
yes,
August,
no,
August,
there's,
August.
well, that's right. I didn't, well, there's more September ones. You're right. There's, we're gonna be going back onto the Southern Virginia, no, Southside, excuse me. Southside Virginia Community College again, as we did last year, which so often people invite us back. Again in September to host Rapid Revive and Lock and Talk on both their campuses. That'll be going on social media soon. The dates of that, I don't have on there, but I do know them. They're September 11th in Keysville, because of course, obviously they have 2 campuses, and the one in Alberta is on the 13th. So we'll be offering Rapid Revive and Lock and Talk training to the students and staff and on those 2 college campuses for about 4 hours on September 11th and 13th. Secova Summit, yeah, we have lots of wonderful, wonderful stuff, and trying to forecast out as many trainings as we can all the way to December is my goal, one of my goals for the next 6 months. So people have enough time to sign up. All right, so I'll have a lot more training announcements in the minutes for this month, as you can see, than we've had in a while, which is wonderful, wonderful, people reaching out wanting to host trainings. All right, anybody else? All right, Liam, are we ready to adjourn the meeting? Next meeting is August 15th, same room, same time, same link. If you want to go ahead and register now, you're welcome to.
Yep, same room, same time, same link, different leader. Just a reminder, I won't be here for our August meeting. But I hope y'all are all able to attend. Thank you all so much for being here today. And Kenan, thank you for another great meeting. Yeah, I think it's safe to go ahead and adjourn.
Motion to adjourn.
All right, 11:40. All right, thank you guys. Oh, I'm gonna stop the recording.
All right, bye everybody. Thank y'all.
See you guys. Bye. Bye, bye, Elizabeth. Your stuff? There it is.